Wherever you live in the UK, you're probably closer than you think to someone at risk from the cold. And with power prices soaring, so is the number of people living in fuel poverty. Grants are available, but the challenge is reaching those most in need, the elderly and very young, whose health is threatened by the lack of heat. A scheme in Gloucestershire is showing it can be done.
The Gloucestershire Warm and Well scheme promotes the health benefits of energy efficiency in the home, and it takes householders in Gloucestershire through from advice on energy efficiency to actually getting measures installed in their homes. We handhold them through that whole process.
Warm and Well is managed by the 7Y Energy Agency, a not-for-profit charity dedicated to improving energy efficiency through local action. In the 5 years since the programme started, they've advised 16,000 households and improved nearly 9,000 homes. That's about 3.5% of all households in the county. Latest to benefit is Mrs. King, whose home is being insulated using the cavity wall technique. It may not look spectacular, but this is one of the most effective measures against heat loss. About 35% of heat escapes through the walls of people's homes, yet drilling holes and pumping insulation material into the gap between the interior and exterior walls has a dramatic effect.
It takes about 2 to 3 hours for a house this size, and they should notice a difference.
There's no shortage of households eligible for an upgrade. June Pearce is another beneficiary of cavity wall and loft insulation, both augmented by new radiator thermostat controls. She's noticed a difference, both to her pocket and her health.
It's been much warmer. Obviously in the winter I don't have to have my radiators up quite so high, so therefore the bills have been a lot lower, especially the winter quarter, which is always very high anyway, and that made quite a difference to that one. I don't get so many aches during the cold weather when I'm inside. I'm comfortable, I'm relaxed, I'm warm, I'm happy, I'm fine.
The benefits of energy-saving measures are so clear there is plenty of government funding, but schemes find it hard to target those most in need, especially in rural areas. Aware of the problem, Warm and Well uses as many media as possible to reach local groups across the county.
The BBC Radio Gloucestershire
Action Desk.
Get the very latest from the CSV Action Desk.
The Action Desk has been really busy as ever today, Martin, particularly with calls about the Warm and Well scheme. As you know, we're offering grants and discounts for loft and cavity wall insulation to everyone across the county.
Staff from the NHS and local authorities are trained to recognise vulnerable households, while immigrant communities are also targeted.
I think this will be very popular when the word gets out, because it's a very easy service to access with a 0800 number, and they do offer leaflets in translated languages, and then people can access the facility quite easily, and then they can find out the information, and from then they can be assessed.
Another key to the programme's success is keeping applications simple. There's a single number for the public and professionals calling in. And at the other end of the line is an energy advisor, ready with the latest advice.
Good afternoon, Gloucestershire Energy Efficiency Advice Centre.
The next step is a home visit, where needs are fully assessed.
Do you know if you've got any insulation in your loft at all, on the floor of the loft?
Yes, we have, but it's only about 2 inches.
Because Warm and Well keep up to date with the demands of applications and grants, they can recommend the best course. And by sticking with the same installation company, over time they've been able to develop new areas of expertise like solar water heating. But the scheme couldn't have got this far without constant attendance at meetings with their partners across the county.
It's not good enough just to inform an organisation once about what you do. It's really important to get the personal contact, personal buy-in and commitment, particularly from people who are in decision-making roles. We need to keep reminding them that Warm and Well exists.
So how would an Ashden Prize help?
One thing we would do would be to try and spread the word elsewhere, to package our approach in an easily digestible form. Locally, we'd like to do more to reach vulnerable households in the under 60s group. We'd like to reach families with small children, better than we do now. We'd like to reach adults with basic skills problems more effectively, and this takes a very targeted approach.